let's get going this morning. Have you been diagnosed with low thyroid? Are you taking hormone replacements, but you're still experiencing symptoms? Do you suspect that you have a thyroid problem? Although doctors say your test results are normal, well, there is hope. Chiropractic physician Dr. Joshua Red of RedRiver Health and Wellness Center, he is here to help improve your quality of life. Great to see you.
Thanks for having me again.
Oh, I'm so glad you're back
Always
talking about this,
Yeah.
because so many people suffer from this, as
So
you
many,
well know.
and not many people realize it.
Yeah, so what are the symptoms? What should we be looking for if you feel that you may have an autoimmune low thyroid?
The most common ones will be depression, fatigue, weight gain, and then they can't lose weight, even if they try. If it's really bad, they'll end up having intestinal problems or joint pain, headaches, hair loss. There's so many different symptoms that go along with it.
Are they confused by these symptoms in the sense of, you know, they think they feel right, but no, they know something's just off?
Yeah, and I think the biggest problem is because a lot of these patients, they're already on thyroid medications and they're already seeing their doctor, and yet their symptoms still persist and get worse. And so they're left confused, feeling kind of hopeless, wondering what in the world should they do because none of their symptoms are improving. It's kind of a frustrating thing for these patients.
Yeah, because you go to the doctor, you tell your doctor your myriad of issues that you're dealing with, and you still experience those problems even after they put you on medication.
Yep, and this is the biggest key. If patients don't understand why they have a low thyroid to begin with, that's a problem. That's the first question you should ask. And the number one cause of low thyroid is what's called Hashimoto's disease, which is actually an autoimmune disease, so it's a lot bigger of an issue than just thyroid problems. So these patients will have an inflammation throughout the whole body. It ends up creating a lot of brain inflammation and intestinal problems and just problems everywhere. It's a lot bigger issue than just the thyroid, actually.
And you know, I have to tell you, and I've shared this with you before, I heard Hashimoto's for the first time with you on this show. And afterward, people were coming up to me in the hallway saying, I think I had that. I just heard about that as well. So it's a serious issue. How
really
are you different than other doctors? What are you doing differently?
Well, here's the key. Like, we don't want to just address the thyroid issue. Our biggest goal is to actually address the autoimmune problem. So here we have a patient that was struggling with multiple autoimmunity and with Hashimoto's as well. If you look at her lab test just 3 months prior on the left side, look at all those highs. Like, she ends up having just iron problems. Her triglycerides are a disaster. She has what's called a C-reactive protein that's really high, which is suggesting really high inflammation throughout the body. I mean, even just a normal patient, if they have this big of a problem with blood work, they're going to feel bad. But then just 3 months later, if you look on the right side, look how much better that blood work looks.
Wow, there's only 2 highs on that list.
That's right, just by addressing certain problems. So if somebody has these mechanisms that are all causing the autoimmune response to flare up, if we can go through and actually address them with dietary, lifestyle, and nutrition, and then really teach and educate the patients how to keep things in check and keep things function a lot better, it's amazing how much these patients feel better and how much they have a better quality of life. And that's kind of our biggest goal, is teach them so that they're the expert in their own health. Teach them so that they're finally educated and understand.
Right, because I was going to ask you what changes were made, and those seem like very minor changes.
Really minor changes, just identifying the mechanism of the issue and then working on them rather than just treating symptoms, right? And so there's so much that we can do with diet, lifestyle, and nutrition, and then we'll also work with the prescribing physician and things like that. But it's important, instead of just treating symptoms, to actually get to the problem, right?
And so many people, and I know you know this, they have trepidation about going to the doctor because they're like, well, I don't want to know what's really happening. But at the end of the day, a simple blood test could give them those results. And it can, 3 months, you said, right?
Yep, makes it so much more simple. And a lot of these patients think this is the new them, right? And in reality, it's not. You just have to get to the mechanism of the problems and really work with the patients rather than just treating the symptoms, and it makes such a big impact. I mean, a lot of our patients will have anywhere from 0 to 5 good days a month.
Wow.
I mean, they're just struggling big time.
That's a rough quality. That's no quality of life.
It's terrible. And if we can get them to where they can have 20 to 25 good days, that's our big goal.
How's that patient now?
The patient is doing so much better. I mean, she's lost 30 pounds. She feels so much better. Her quality of life is better. She's able to do the things she couldn't do before.
All right, so let's give you some information. Dr. Red is offering free consultations, plus anyone who comes in for a consultation will also receive a free copy of the Amazon #1 best-selling book on thyroid, The Truth About Low Thyroid. That is Dr. Red's book. RedRiver Health and Wellness Center, they are located at 8765 East Bell Road, Suite 103 in Scottsdale. To book your appointment, 480-970-5555 or visit redriverhealthandwellness.com.